my name is Micah Allen. I am a naturopathic doctor and licensed acupuncturist, currently residing in the Richmond, Virginia area. So it's just super exciting to be able to level my practice up even more than from when I started.
How many years have you been in practice then?
13 years now, which is kind of wild to even say that I've been in private practice. Some of that was in Seattle, Washington. So the first portion of my clinical time in practice was in Seattle, and then moved to Richmond right at about 7 years ago now. So I've had both the West Coast license experience as well as now being on the East Coast. Obviously, there are some states that are licensed for naturopathic doctors, but Virginia happens to be one that is not. So, being able to practice in a pre-licensed state as a naturopathic doctor, but also, obviously having licensing as an acupuncturist here. So, it's been really exciting. The 13 years have been, lots of ups and downs, lots of pivoting, but it's definitely worthwhile. And yes, I don't think I would ask to be doing anything else. So yeah, just really great time so far.
What kind of areas do you focus on in your practice?
So most of my practice, I would say, is targeted towards chronic pain management. And then another large portion is fertility. So my practice is hybrid. So most of what I do on site is acupuncture services or things related to acupuncture. Um, Actually, during the time with Chin, I have created a different offering that is allowing me to provide naturopathic medicine coaching consultations to clients. And so that portion of my business and practice is mostly virtual. We do have folks drop in occasionally just for quick, coaching calls or quick coaching consultations. So it is a hybrid practice, chronic pain management, fertility, but we also help folks, a lot of folks who have exhausted all of their options and are just trying to figure out the root cause. And so we will bring those patients on as coaching clients.
Wonderful. Do you accept insurance or mainly cash or what do you?
Yeah, so we are in network with a few insurance panels, one or two, but the majority of our clientele are cash paying patients. So, especially with the naturopathic coaching, those patients are going to be completely cash only. A lot of them utilize their FSA or HSA accounts. And then we also have some clients who are utilizing care credit because, of course, the acupuncture portion of the practice, allows us to be able to use that tool as well for them. So, yeah, it's a mix.
And what were you feeling most frustrated with before you were part of our six-figure Speaking Makeover mentorship?
Where I feel like things really turned the corner for me with my time in the mentorship is being able to convert, a lot of the clients that we were doing a lot of marketing, whether it was TV or newspaper, Google, a little bit of Facebook ads, but we were getting quite a few folks who were interested in the services, but our conversion rate was not, allowing us to be able to serve the number of people that we wanted to be able to serve. My time with Chin has allowed me and the practice to therefore increase our opportunity to serve more clients and more patients by being able to show them the value of our services and how it can help them long term.
Yeah, and let everyone know what kind of results you had experience with that. Like, what were you experienced with conversions before, and what did it get up to that you're excited about?
Yeah, so the conversion was, can't remember the number right off, but it was dismal. So I'm going to say like maybe 30% of conversions with our consults that we were doing. And that was going on for, maybe about 2 or 3 months. So it felt like, man, what's happening? I know there's some changes as far as inflation is concerned and lots of, just changes in folks' lives. But we were able to, like, with implementing email prompts, some of the infographics, and they were all plug and play, so very easy to be able to bring in and kind of envelop into our already existing system. But we were able to move from a 30% conversion rate to, I feel confident now to say, like 85 to 90% conversion rate for those consultations. And I think too, I'm going in a lot more confident. Again, not that I wasn't confident before, but now it's like after a while, and you're seeing that the system and the templates are working, you just get really excited to be able to go in, share, show the value, and then onboard those clients and patients, which ultimately, you're going to be able to help them reach the goals that they are looking for. So I'd say moving from 30% conversion rate up to about an 85, 90% conversion rate.
Yeah, congratulations. That's huge, right? That's like, and it's like three times
Yeah,
the amount, which is like three times the patient flow, three times the income, right?
right.
Super exciting. And let everybody know your like the range of service offerings and fees.
Yeah, so the range, I mean, because obviously, like, folks like to say the riches are in the niches, but I feel like here on the East Coast or in places where there aren't an abundant number of providers like myself, a dual license provider, it's like at some point you start to think, man, there's so many different ways that we can help support folks. So obviously we have our traditional acupuncture services. We have other modalities that we incorporate as well. So we have a medical massage therapist who's on site. We also have Chinese herbs that are prescribed as well, supplements, nutrient coaching as well, or nutrition coaching as well. And then obviously with the naturopathic medicine, it's more of a deep dive. So we're looking into all of their health history, labs, just kind of reviewing those and giving them some options to help them, empower them to be able to advocate for themselves and make better choices. So the range in services is pretty vast. And I would say our lowest, we have some membership options for folks who are going or rolling into maintenance plans. And so I would say our lowest service would be, our silver membership, which is $150 per month, and that's going to be on auto pay. And we have some services where we see clients who are coming in for fertility support, and those prepayment plans can go upwards of $4,500. So, it's a pretty wide range, but again, it's high value, high touch, quality care, and folks are getting, effective solutions for their healthcare goals. So just feel really good about it.
Yeah, that's wonderful. What would you say has been the difference between being in a licensed state and practicing and then now an unlicensed state? Like what kinds of words of wisdom or just reflections have you had?
Yeah, I would say like it's completely different. Not even from the aspect of it being pre-licensed versus licensed. The environment, the folks are just different because of just the knowledge and awareness of complementary medicine is so different. But I would say, for me, practicing in Seattle was in a licensed state. I heavily depended on insurance panels. So it was like never in my mind would I have ever imagined, having a cash practice in Seattle, just because obviously I had not been exposed to that, because I know that there are some providers who do that in the state. But it was just something that was, it's like everybody has insurance. Like nobody is cash that I had been exposed to. Like in school, obviously we didn't really see the business side of things at all. It was just treat patients and, continue your study. So I think moving to the East Coast and being in a pre-licensed state, it really like opened my eyes to the possibility of having a cash-based practice. So I would say that would be like the biggest eye opener for me. Obviously, the accessibility, people knowing about what you provide on the West Coast is going to be a lot more vast. But on the East Coast, things are growing. Like I think visibility and the knowledge around how helpful complementary medicine is and how it can be, supportive as well as sometimes a lead modality, I think is helping. So that would be what I would say is just my overall view. Obviously, there are some other subtle shifts and adjustments and changes, but those would be the broadest things that come to mind.
Yeah, it's really important, even more important to be educating the public and other providers so that they're progressively more aware about how naturopathic medicine and acupuncture and other complementary options are available to help people. So with that, then like more people will be asking for it, right? So
Yep.
yeah. And what had you interested in like speaking more?
Yeah, I think for me, the speaking portion was more about being able to build relationships one on one with providers. And so that was really where I wanted to be able to like target and focus because I am, naturally an introvert. So the thought of speaking in front of large crowds still isn't like super appealing to me, even though with Chin's help, we were able to land a talk at an event that we're going to be doing next week. So for me, it's, I'm still trying to get my head around it, but I know that I got the tools to do it. So yeah, for me, it was more about like that one-on-one with providers, being able to convey value, mainly because we have so many patients that come in and we're hearing and seeing a lot of them being referred by either their primary care specialist or a specialty provider. So I wanted to be able to have the tools to be able to communicate. Obviously I know, the medical lingo, I know how to, talk the talk, but to be able to be in a space to where, again, just like with the patients and the prospective clients, is to be able to share and show the value of what I have and what we have as a clinic that can help benefit the long-term effect of just healthcare in general, right? So how we can build and create a partnership that's going to move healthcare forward in a positive way.
And how do you feel like the 6 Figure Speaking Makeover Mentorship has helped you with that?
Those plug and play templates are super helpful. So, I know exactly what to say, how often to say it without, feeling or being overwhelming in a sense. Um, Also, being able to outline or create a blueprint for a talk. Again, that's going to be just like when I'm one on one with the patients and clients in office, but something that's going to convey value and something that's going to help with, having that call of action, encouraging and empowering people to make a decision to make a change. And that change can be, by coming in to see how we can partner and move their healthcare forward. So, yeah, lots of templates, lots of blueprints. Like I said, very easy to, prompts that were helpful in creating these talks.
And how do you feel like the Speaking Makeover Mentorship is helping you with getting booked?
For instance, for this event that's coming up soon, it was just a simple ask. Like in the past, I would have never asked, like, hey, do you guys have, the option for, a 15 or 30-minute spot for speaking? And it was just as simple as that, just to ask um, you know, the young lady who is over the event. And she was just like, let me check and see. And she emailed me back within, a few hours and was just like, actually we do have a 30-minute spot. Like you won't have any fancy PowerPoint presentations. It'll just be a microphone. But yes, we can do it. So yeah, I think before I wouldn't have even thought to ask. So that part again, very simple. straightforward, but also effective. Yeah.
Yeah, wonderful. Yeah, it helps to be prepared.
I'm excited. I'm a little afraid about next week because it sounds like it's going to be a big crowd. But I'm sure, like I said, as always, you rise to the occasion and you have what you need. But it's just getting out there and doing it.
And what kind of an audience are you going to be speaking in front of?
So the audience next week is going to be first responders. So my talk is going to be around, or they've requested the talk to be mostly around mental health. But obviously, acupuncture or naturopathic coaching can be beneficial in that aspect. But also remembering that first responders are also, moving their bodies. They're exposed to sometimes, physical restrictions and limitations where they have to push past those because they're saving someone's life. So we're going to be sure to roll in the piece around pain management as well as emotional and mental health, which I think is going to be fabulous because acupuncture specifically does such a great job in being able to help folks with transcending the physical pain and disruption, but also the mental, emotional planes as well. So I think that's the part that really gets me excited, gets me more of that, extroverted introvert, is because I know that I'm going to be able to help someone who may not be aware, again, of the benefit that this medicine holds.
Mm. How was this experience different from other kinds of business trainings that you've had in the past?
Yeah, I think, each mentorship is different. This one, like I said, was very easy to be able to implement. So it didn't feel like you had to wait in order to progress. There were past recordings, like if you wanted to go ahead of where you were in your normal cohort, you could do that. So for me, I'm a really quick implementer. And so I was going ahead and, getting things done, using referrals that Chan recommended and getting infographics. So it was very helpful in that way, that you could kind of create your own pace, but you still had your weekly meetups with your cohort so that you could collaborate, you could kind of talk through things with folks who were in this process with you. So I think the biggest part for me was the accessibility and being able to implement it as quick as I needed to.
How did you feel about the experience with the other practitioners who are also part of the mentorship? Like, what was that like for you?
Yeah, everybody was like super helpful. There's the private Facebook group. So, we would post 3 to 4 people, commenting on something that you took the time to do as far as like a template or a paper or a speaker one sheet. And so it was nice to have that, collaborative, portion of the mentorship, and everyone was super helpful. Everyone, I think, had the same goal of being able to learn and grow during this process. So it was a great experience for me.
And what's your vision for your practice now that you're excited about?
Oh my goodness. So I guess what, year 13, the vision now is like it's always been about like getting a stable flow of patients, being able to, see and help and serve a certain number of patients. And now for me, my kids, I have an 11 and a 15-year-old. And, soon, like we do a lot of traveling now, but soon, there's going to be college and wanting to travel to see, said kid who's off and away. I already have a lot of flexibility now, but from the next step, I think, is to be able to, multiply myself. So getting another, acupuncturist, maybe, an additional naturopathic doctor, another massage therapist. So basically expanding as far as the providers that are on site. So that way I can lessen the number of days that I'm currently on site. I still love the idea of patient care. Like I have not tired of that at all. But I think that's just the natural progression to be able to set myself up to, have more time outside of the office to, just enjoy life.
Yes, good to have both, right? And so if you knew then what you know now, what advice would you give?
I would give the advice of, because I've seen you in the space for probably like a year and a half, possibly more. Um, and obviously, everything has its timing and its place, but I would probably say, jumping on this sooner, starting the mentorship sooner, would be what I would tell myself, especially because I think it might have been 48 hours from when I started. I saw my conversion rate move like that quick. So, yeah, I would say jumping on the bandwagon a lot sooner than I did.
What would you say to someone who might be on the fence?
I would say, we always should be looking to invest in ourselves, because the information and the knowledge that I've gained during this time is not something that I'm ever going to put to the side or put away. It's now a part of my system, a part of, the way that my process works in my clinic. So that's something that, is not, consumable. It's something that's going to be long lasting. And yeah, no one can take it away from you. And not just not having it taken away from you, but it's something that's going to help build and grow not only your self esteem and your confidence, but it's going to, help with growing your business and help with your ability to, again, serve your clientele and your patients. So, um, yeah, that's what I would say.
Well, thank you so much for taking the time to be here with us, Micah. And I'm excited about your having higher conversions, which means that you're helping more people through
Yeah,
this, and that's fantastic. And then also having the speaking opportunity coming up too, so super exciting. So
yes,
congratulations, and
thank
just
you.
I'm looking forward to seeing what continues and unfolds for you. And for those of you who are in a place where you are at a plateau in your practice, or you just feel like you're capable of so much more and you would love to grow with more ease and flow and make a bigger impact, then feel free to check out introvertedvisionary.com and book a free call with us. I'm more than happy to see how we could help you grow faster. And thanks again for being here.
Thank you. Thank you so much, Chin. And thank you for all that you do. I really appreciate you.